The Mannin Line with Andy Wint.
Faster my good afternoon. Welcome to Mannin Line on Manx Radio this Thursday lunchtime. Today it's all about Manx care with the new interim Chief Exec, Chris Stockport. Dr. Stockport is here with us today. And if you want to get in touch, text, email, call and WhatsApp. Well, apparently the government says his central task is to lead Manx Care through governance review between Manx Care and the Department of Health and Social Care. And whatever you want to talk about, by all means, do get in touch. Just run a pen portrait around this. Manx Care was established in April 2021 by the government as an arm's-length organisation established to focus on delivery of health and social care on the Isle of Man. It followed a review by Sir Jonathan Michael. DHSC continues to be responsible for strategy, planning, policy and regulation. Is that right, Chris Stockport? Is that all that correct?
Well, that is all correct.
Well, faster by. Good afternoon.
Hello.
It's been a wee while since we saw you. First question that came in, and this is from Joan, and she says, with an election on the way, is there any shadow over Manx Care? And I guess what she's saying is, obviously it's 2021 that Manx Care came into being, and there's been all sorts of talk about it, and obviously with budget overruns and this, that and the other. The future for Manx Care, how do you see it?
Well, you've just referenced the governance review, Andy. So there is a piece of work underway at the moment, which looks exactly at that. And how do we best position Manx Care so that it is able to work as effectively as possible within a wider public service and government environment, and that's right and proper, of course, because everything moves on, and you learn as you go along. I think what's important is wherever Manx Care sits, it's still about delivering healthcare and social care for residents on this island. That has to carry on. So I'm really most focused upon how we do that, wherever that should be. Okay, and in the middle of all this, I mean, there's no getting around this. There's been a major leadership change. You've got to provide continuity. Obviously, the chair and other senior leaders are changing as well. So you're the lighthouse in the middle of all this, trying to keep the ship on course. I'm the lighthouse in the middle of 3,500 staff, all doing a good job, many of whom haven't changed. And so, the show goes on, and I'm incredibly grateful to people for all of the work that they do, and we will continue moving forwards, irrespective of the changes in terms of leadership. 3,000. A little over 3,000, yeah. An enormous amount of people that you have to... and do you think, bearing in mind what I've just been talking about, it as in leadership changes, do you think we often sometimes focus too much on the leadership and forget about the people who actually do the work on the shop floor, as it were? Oh, absolutely, entirely. Nothing works without those folk that are actually day to day getting involved in delivering care in whatever form that be, whether that be social care or health care, and that's where that's where the important conversations occur. That's where the important conversations with members of the public occur, and it's where important conversations for people like myself occur, because that's where I find out just exactly what could be done differently, what is working and should be done, continue to be done in the same way. So absolutely, they're the bedrock of what we do and where we should be focused. Okay, and just to reiterate, as a clinical director, what was your day-to-day job as clinical director? So previous to this, I was the medical director, and the responsibility for that really is overseeing the clinical quality of services and supporting particularly our doctors, but not just our doctors, in their role in contributing to that. Okay, right, let's get to the phones. Richard's first with us today. Hello, Richard. You're live with Dr. Chris Stockport from Manx Care.
Good morning, Dr. Stockport. I congratulate you on being appointed as interim CEO of Manx Care, which I think gives you a wonderful opportunity to transform a very unsatisfactory situation regarding the waiting list. I think the whole Manx public, one of the main concerns is that we have a waiting list which equates to over 20% of the population on one of your waiting lists. And if you look at I've commissioned, as you probably know, a very deep investigation into the governance and the waiting list situation. And this has revealed that the position is particularly bad for those on the waiting list of more than a year. Where we have about 8,000 or nearly 8,000 people having been on a waiting list for more than a year. The comparative figure for Jersey is, well, the 8,000 in the Isle of Man is about 8%. In Jersey, it's 3%, and in the UK, it's 0.32%. So that sort of illustrates the gravity of the situation that we're all faced with. And really, it's something that needs to be actioned urgently, because a lot of people are suffering, not only the people on the list, but all their relations. And many people are incapacitated and unable to get about at all.
Okay,
and those looking after
Richard, which particular waiting list are you talking about? For what sort of service?
I'm talking about all the waiting lists. If you look at the total figures, you'll see that there's about 17,000 people on the waiting list at the moment.
Okay, well, let's ask Dr. Stockport. Your response, Dr. Stockport.
Yeah, afternoon, Richard. Thank you for the work that you have done on this. I'm aware of that work. I would agree that there is a lot of work that we need to do on our waiting lists, and it's there at the top of the list of priorities for myself and my team. One of the problems that we have with managing our waiting lists is the extent to which we rely upon paper records. And we know, as we're looking through those waiting lists, that we're haven't been able to manage them in quite the way that we would have done had we had some sort of slightly more up-to-date approaches to them. And it means that on some of those waiting lists, there are a number of patients appearing on several occasions, sometimes patients waiting on different waiting lists for the same condition, and that's just not where we would want to be. It causes confusion for us, but most importantly, it causes confusion and dissatisfaction for those people sitting on those waiting lists. So there's a load of work to do there.
Could you possibly explain how somebody can be on two lists?
So sometimes, and I'm thinking back to the days when I was doing a general practice more than I do now, you'd refer an individual for a problem and you'd refer them to a particular specialty. And then as they sit on that waiting list, their condition may evolve or become a little bit clearer, and you then realise that they need to actually be seen by a different specialty. So you'll refer them to that different specialty, and often they then don't come off the waiting list for the first specialty, just as you'd imagined might be the case. And so then you end up with a situation where people are sitting on multiple waiting lists. There are ways to manage that, and we need to do more to deal with that. Even when we've dealt with that, of course, our waiting lists are longer than we would want them to be, and I'm really grateful to work from Treasury and the department in supporting us to put some more resource in to dealing with those waiting lists that are the particularly long waiting lists.
Okay, Richard?
Yes, I see a sort of grave problem. I don't want to accuse anybody, but we've got a really fine hospital, wonderful staff running it, and great carers. But this is one big stain on Manx Care, and it's something that really needs to be actioned. And what worries me is that while the waiting lists are so long, people are being forced to go and pay privately for a great deal more than it would cost Manx Care to do it. And the problem is, it really gives Manx Care, I'm not saying this is the case, but it makes you wonder, because Manx Care have an incentive to go the wrong way, because the more people have to pay, the less people they have to treat and the less money they have to spend treating them, which is a very unfortunate situation, to say the least.
Okay, what's the situation regarding getting records onto computer then, Chris Stockport?
So we're making progress. Colleagues may well be aware that there's a long piece of work underway in terms of computerising healthcare more generally, called the Manx Care Record. But there's a lot that we can do before there in terms of being more consistent in how we record and manage different waiting lists, how we communicate more clearly to those people waiting on those lists to make sure that they still need to be seen, to establish if things have changed. And we're doing all of that now. Of course, when you have a long waiting list to manage, it takes a while to be able to work through that. But just to go to Richard's original point, it is there at the top of my list of priorities. It is a piece of work we can do and should be doing at greater pace. I agree.
Okay, Richard, we appreciate your call. Thanks for being with us.
Okay, thank you.
Thank you. So what's the next step then, Chris Stockport? Is it have you got the budget for the new computer system? Have you got the computer system? Whereabouts are you on the ladder?
The process is underway in terms of that procurement exercise. Colleagues have recently put out for expressions of interest, and there's then an assessment process to work through that. But there is still, to go back to my point about what we can do in the meantime, still plenty of things we can do in the meantime. And on my way here today, had a long conversation with colleagues about just how we can increase the pace on some of that. So expect to see some progress on that as I do. Okay,
here's Ken with us now. Hi Ken, you're live with Chris Stockport.
Afternoon. I'd like to ask what happened to the consultation on Manx Care homes and how much you should pay. What was the result of that?
I'm not sure what consultation that is.
Just specifically, what about, Ken?
How much you should pay before you go into a care home. Right. There was a consultation and a document you filled in. Should it be free?
Oh, right, yeah.
100,000. The optimum figure was 100,000. So if you sold your house for 300,000, once they took 100,000 off you, that was it. You kept the extra 200,000.
Right. Okay.
What happened to that result?
Okay.
What was the result of that consultation?
I think that may have been a consultation by the Department of Health and Social Care. Right. I don't think that was a Manx Care consultation, and I'm not sure what the outcome of that was.
Anyway, what's your opinion, Ken?
Well, like Scotland, perhaps it should be free. The government position was it was going to, the suggestion of it, and I'm sure the two ladies that were running it were employed by Manx Care.
Right.
From memory.
Well, we'll find out, but I mean, this is the position whereby, and it's often quoted, whereby people who've husbanded their resources throughout their life often get their house taken away and the money taken away, and people, I'm putting it bluntly, but people who haven't get the thing for free, and there's some disquiet about that. Ken, am I right?
Well, yes, obviously. I'm just wondering whether he could find out then.
Okay.
If he's saying it wasn't to do with Manx Care. I know he obviously doesn't know everything.
Right, okay. All right, Ken. Well, we'll follow that up, Ken, as well. Does Manx Care have a view on that, Chris?
So my view really is that's a political decision to be reached, and we'll provide the service that we're requested to provide through the mandate and do it as well as we can.
Okay, let's get to Stephen with us now. Hello, Stephen. You're live with Chris Stockport.
Oh, good afternoon, Andy. Good afternoon, Chris, and good afternoon, listeners. I wonder, could I ask a question, Chris? I know you're relatively new to the position, but you might have some information. Has there been any problems in recruiting staff due to a lack of accommodation on the island for these staff? Because I hear of people who've tried to come over, certainly in education, etc., and they've failed to get accommodation due to our lack of accommodation at short notice and let. So has healthcare suffered this problem, and are you aware of anything?
Thank you, Stephen. Speaking frankly, recruiting staff can be difficult to health and social care settings, and we're constantly reviewing how we can better recruit staff, whether to permanent posts or to short-term posts. We do everything that we can in doing so to support their entry into the island in terms of accommodation and things like that. It can sometimes be difficult. We have some accommodation of our own, but it's often not sufficient for new staff coming in, and we work with other government departments to try to find ways in which we can make that easier. It isn't the most significant part of difficulty in terms of recruiting healthcare professionals, but it certainly sometimes comes up.
Okay, Stephen, what have you heard?
Well, only that I was surprised, because when you look at the reason that it was sold to carry out the renovation of the old nurses' building on Westmoreland Road, that this would provide essential accommodation for essential workers, and I have no problem with that. I don't think anybody did. But I was surprised that, if I'm correct in saying this, that it was reported that no departments of government approached or wanted to engage with MDC or the letting agent to take some accommodation in it. So I'm surprised at that. And I think possibly that was a missed opportunity, because I do hear that people say that's a big problem of getting accommodation, although I accept that it's not your issue, Chris, because you were not in post at that time. But I think it's something that we should have been cognizant of, that was the reason it was designed. It was said that we're going to do the renovation, and yet there's no or very little accommodation being reserved for essential workers. So I would hope maybe that could be reviewed again at some point. Who knows? Okay.
All right, Stephen, thanks for calling today. You were talking about there are some issues recruiting. What are the main issues in recruiting people to Manx Care?
We globally are recruiting against a strong field of other providers, and insufficient staff being trained to fill some of those posts as health and care develops in terms of what they can provide to people. So the need for clinicians and specialist clinicians increases and increases, and we compete against the UK, but not just the UK, against Europe, America sometimes, parts of the Middle East, and across the world. And so our terms have to be competitive, right. and what we offer, and it's not just doctors, it's across many of our health and care settings.
Okay, are we training nurses on the Isle of Man?
We do train nurses on the Isle of Man.
And if those nurses train here, do they stay here?
On the whole, yes.
Right, okay. And as you say, geographically, we're an outlier where that's concerned, because people have to want to come to the Isle of Man. So do we pay the going rate, or do we pay slightly above the going rate in those terms?
We pay the going rate or slightly above. One of the difficulties we have is, if I think about my own profession, but the same applies to others, if you look across the UK, where they train, most of our training doctors come from, they train doctors to be really quite specialist doctors. That sometimes doesn't work terribly well on an island of 85,000 people, where you need doctors with a slightly broader skill. So sometimes it's about money, and sometimes it's simply about the number of people with the skills that you need.
Okay, as you mentioned, you were in general practice. For how long were you a GP?
So I think I'm 30 years qualified now, so probably the best part of 20 years doing it day to day.
So you'll have a very keen focus on GPs on the Isle of Man and the GP service that's delivered. How do you see it overall?
I think we've got a fairly stable and certainly enthusiastic cohort of GPs on the island. They're busy. General practice has changed almost completely since I started in it, and I think one of the challenges is just the amount of paperwork and things that go on behind the scenes. It's not just about seeing 20 patients in the morning and 20 patients in the afternoon anymore. The other thing, of course, is how general practice has changed in terms of the professionals working in it. It's not just GPs and the practice nurses anymore, but a whole raft of professionals. And I'm seeing colleagues on the island explore how to grow into that, and all the challenges that come with doing that. It's certainly a difficult profession.
Well, my GP told me that GP practice has changed completely in the past 5 years, let alone in the past 30 odd years. So how many GP practices does Manx Care run at the moment?
How many do we run directly,
yes,
or how many other
just
on the island?
Directly.
So we directly run one practice.
Okay, and the rest, it's fair to say, are they businesses? How do they operate?
Yeah, it's pretty much like the UK model, where the GP practice is an independent practice, so they are their own businesses, and they contract then to Manx Care to deliver the NHS service that we require.
Okay, let's go to Gordon with us now. Hello, Gordon. You're live with Chris Stockport from Manx Care.
Good afternoon, Chris. Good afternoon, Randy. I had an experience last year. I want to talk about bed numbers at Nobles. I wasn't well through most of last year and was under investigation for several months by people various. It wasn't until I had an MRI scan of my spine in October that they found out I had severe compression of the spinal cord in my neck. So I ended up going air ambulance to Liverpool, spent 3 weeks in Walton, and had what was described as a complex 5.5-hour surgery on my neck. Hello, you still there?
Yeah, go ahead.
Yeah. Now, the plan was that when I'd had my operation at Walton, I was going to be repatriated to the island to do my physio, occupational, and discharge to home from here. Now, after I had my operation, Nobles accepted me for repatriation, but I lay in a bed in Walton for 10 days, and every single day of those 10 days, Walton were told there are no beds at Nobles, and there are no likelihood of being a bed available anytime soon. So after 10 days, I was discharged by Walton. I was chucked onto an EasyJet flight home, and I came home. I didn't see a physiotherapist for 5 months. Nobody rang me to find out how I was getting on. There was just complete lack of support when I got back here. And the physiotherapist I eventually saw was completely appalled at the situation.
Okay, so did you try and speak to anybody? Did you make any calls yourself to see what was going on?
I did, but I didn't get anywhere.
Okay, does this? Can you recognise this at all?
So I don't really recognise that, Gordon. I'm really pleased that your physiotherapist was appalled at that situation, because I'd be appalled at that situation too. That's not what we should be offering. It's not, though, my experience that we have long waits in repatriating people back. That we have a strong working relationship with the hospitals broadly in the Liverpool area that we work with in the UK, and I very much recognise not just how important it is for them to get people back here when we can manage them here, but how important it is for the patients and for their families. So we work hard to get people back as quickly as possible. I would hope that experience is a relatively unique one, and I'm certainly happy to explore it offline with you if that would help.
Okay.
But it's not a common situation that that I'm aware of.
Gordon, would you be happy if we took your number to give that to Dr. Stockport, and we'll take it on from there?
I don't really want to make a thing of it. It's all water under the bridge.
You sure? How are you now, by the way?
I'm a lot better, but I still have some residual problems with mobility. But I'm a lot better than I was,
okay.
Yes.
All right. Well, we're glad about that. Thanks for calling today. We're live with Dr. Chris Stockport, who's the interim chief exec of Manx Care. Took over, of course, with the departure of Teresa Cope, who we wish well. She's now in Guernsey. And a lot to happen over this governance review and the transition, just to see what's happening to Manx Care. And if you want to get in touch, text, email, call, WhatsApp and text are 166 177, email studio@manxradio.com, or call 66 13 68. It's 12:30.
Crow Isle of Man Chartered Accountants.
Remember when you used to get business advice from your bank manager? Stiff upper-lipped pillars of the community whom you called Sir? Nowadays, you can get all the advice on every business issue from the friendly, down-to-earth chaps at Crow Isle of Man. And some of the chaps are even women. Imagine! Crow Isle of Man. Global presence, local knowledge.
Crow Isle of Man. Crow.im.
Manx Mobility and Onken have it all. Daily living aids, wide-fitting shoes, rise recliners, beds and scooters, including lightweight and airline-approved models. Call in and see how our expert team can make your life easier. Manx Mobility at the top of Summer Hill.
Whatever your business, whatever its size, you can always rely on the island's leading fuel and oil supplier to keep you moving. Ellen Vannin Fuels, powering the island and powering industry. Call us on 844 000.
Carpetland, the carpet specialist with the island's best value carpets in stock, often fitted within a week. Furnitureland for three-piece suites, dining and living room furniture, and a selection of amazing beds. Carpetland and Furnitureland, West Street, Ramsey.
Elevate Rubber Cover from Rubber Roof Shop for one-piece flat roofing systems. No joins, no leaks. We also line commercial box gutters in one piece up to 60 metres with a 20-year written warranty against leakage. Call Rubber Roof Shop on 49667.
Check out the Groudle Glen Railway summer timetable for some great days out. Visit the Clifftop Tea Rooms and Sales Emporium, book a special steamed tea and join our free family train spotting challenge. Hop on the line that goes uphill to the sea, the Groudle Glen Railway. For times, see ggr.org.uk or visit on Facebook.
The previous message was brought to you by QVH, the island's premier serviced offices and co-working space in the heart of Douglas. Call 639 940 for more information or visit qvhpremierofficespace.com.
as Gaelic Nara.
Avashan Rish. A Gaelic, the Manx Gaelic. Ginian Amera, the mother tongue of Ellen Vannin, the Isle of Man. Avashan Rish. You can catch up with more of Manx Radio's Manx language programmes in the weekly podcast Abershan Rish. Say that again. Avashan Rish. Shane, that's the one.
The Mannin Line with Andy Wint.
And Dr. Chris Stockport, the interim chief exec of Manx Care, is here with us. And Chris, the letters DNR can strike fear into many people. I had a couple of messages in about DNR appearing on people's notes without them knowing about it. Could you explain a bit more about that?
Yeah, this is an incredibly difficult subject. So DNR stands for Do Not Resuscitate. I've experienced this journey over many, many years in different areas, and it brings out strong views on both sides of the debate. Sometimes when you have individuals going into hospital who are particularly frail or particularly unwell, healthcare professionals struggle to work out what to do if they, for whatever reason, were to stop breathing or their heart stopped. And that's what Do Not Resuscitate stands for. It doesn't mean that you shouldn't be doing everything you can to avoid that situation. It just means that in that situation, you're not going to commence resuscitation attempts to restart the heart or to restart breathing. And the reason it's difficult is because many doctors will tell you of really difficult situations that they have been in where individuals have had attempts to be resuscitated when there is no reasonable prospect of that being successful because of the individual's wider healthcare situation, and the amount of distress that has caused or lack of dignity. The difficulty with that is that unless you have careful conversations that include the people that you're talking about, then there is a loss of dignity as well. So it really hinges on having really careful conversations with people, establishing what their thoughts are on that subject, having an honest conversation about what the limits of medicine can do, and then reaching a shared decision. Sometimes those conversations are not handled as well as they ought to be.
Okay. Who's responsible for putting the letters on the notes?
It should always be a doctor.
Okay. And do the person or the people surrounding them, the relatives, do they have to know that? Are they required to be told?
They're not required to be told, and there are some circumstances where that might not happen, but I would consider it to be good practice in most situations for them to be aware. Sometimes patients don't want to have that conversation with their family, but I would suggest that the starting position in all circumstances should be that you include people in that rounded conversation.
Okay. I've got some clarification on that, the consultation that was mentioned. The cost of the care consultation that the caller mentioned, Ken, it was a DHSC one rather than a Manx Care one. The report from it went to Tynwald in May, but they didn't vote on it, on what to do next. It was just the publishing of the report itself. They haven't made a final decision on exactly what to do next, and we'll post that actually on manxradio.com on the news if you want to take a look at it. But that's the situation. Can you 468 says, can you ask why the Southern Group practice has a 5 or 6 week wait for routine appointments and Ballasalla surgery has the same week appointments?
So we did talk a little earlier about how practices are independent practices, and they run their appointment system in the way that they choose to run them. And some practices take very different approaches to others. Some practices require you to phone first before and speak to a clinician before getting an appointment. Others only book appointments on the day, and everything in between. We do have conversations with all of our GP practices where appointment times are proving difficult, and I'd encourage your caller to share their concerns with the practice too.
Okay, Vivian's with us now. Hello, Vivian, you're live with Dr. Chris Stockport.
Hello, thank you very much. Good afternoon, sir. I don't know whether you can answer my question or not, and I understand if you can't. I was very much part of the Cottage Hospital. They had a League of Friends. They raised an awful lot of money for the Cottage Hospital, and nobody, and I've spoken to a lot of people, know where that money that was left finished up. Can you tell me?
This is the Ramsey Cottage Hospital League of Friends fund of money that was there, yeah?
And where, if there's any left, where is it?
Are you familiar with this?
I'm not familiar with that, Vivian. I'm certainly happy to try and help you answer that, but I'm not aware of what the League of Friends as a charity, what has happened to them.
Well, they raised thousands, and I'm talking about thousands over the years they were there.
Right.
And it's just out of interest. I'm not grumbling at anybody, but
right.
It just would be interesting to know the answer.
Okay, all right, we appreciate that. Thanks, Vivian, thanks for that, and it would be nice to know, wouldn't it? Funnily enough, another Stefan dropped a note in as well, and could you ask Dr. Stockport, what is the future for Ramsey Cottage Hospital? We hear one thing from one person, one thing from another. What's the situation?
Okay, yeah, very happy to do, because I attended a public meeting in Ramsey just a couple of weeks ago to talk about this very point. In my view, Ramsey has got a very vibrant future ahead, not just the hospital, but in terms of the other services that we can provide more locally in Ramsey that wrap around the hospital too. We're currently in the process of returning all of the services back into Ramsey, and I explained in the public meeting that there's 2 or 3 that are due to move in over the next couple of months, alongside all of the services that have already moved back. The work we had to do in Ramsey was very significant, but that doesn't mean we're not committed to the hospital. We're very committed to the hospital. The inpatient ward opens again in a few months' time, and it is a solid part of our future planning.
This is 152 texted in to say, could you ask Chris Stockport, will you be looking into care pathways for those on the island who are vaccine injured? We were having regular meetings with Teresa Cope, but since she's left, we've had no update despite reaching out.
I'm not sure where the reaching out has been to, because it certainly hasn't found its way to me, but I'll happily pick those conversations up if you want to contact me directly.
What's your email address?
If you want to contact MCALS in Nobles, and on the website there are email and phone numbers for MCALS. They'll make sure that I get in the loop and I can then contact you directly. Okay.
Our son had an endoscopy 4 years ago. He saw the gastronomy clinic February last year with a strict follow-up on August 2025. He was sent an appointment for September 2026. It's now postponed till November, so it's not far off 5 years from the first appointment. He has to have surgery, which may be referred for in November. How long would he have to wait? Do you recognise this time frame, 5 years?
No, I don't recognise that time frame, and I'm slightly worried if it has been that length of time that things have just fallen apart a little bit, and we're not aware of him on the waiting list. Again, if you contact me directly, I'll certainly get to the bottom of it.
I'm seeing more and more medical misinformation and false information posted on social media by unqualified people. We've seen the damage this is causing in the USA already with outbreaks of preventable diseases. What can Manx Care do to counter misinformation, says Steve?
That's a really difficult question to answer, but it's a problem I very much recognise. You see all sorts, don't you, on social media, and it can be incredibly difficult to establish if it's correct or if it isn't correct.
How do you feel as a clinician when you see something that is patently gobbledygook?
So it's incredibly frustrating, isn't it? And you can try to correct that message, but it is only as wide as your own personal readership. So it's hard to tackle. You've got your own local primary healthcare professionals who will give you advice. We'll give you advice wherever we possibly can, and certainly there are occasions when we come across local sort of social media issues where we will try and work with other authorities to deal with those issues directly. But the problem with social media, of course, is it reaches globally.
Dr. Google and things like that. Okay, and this concerns temporary staff, agency staff. A friend of mine recently had to spend a night as a patient in A&E. The nurse who was looking after him said that she was an agency nurse from the UK and mentioned an amount that she was going to be getting paid. So obviously agency staff, and I think we went through this last time we were talking about it, bank staff get the normal rate, agency staff get paid more. Am I right?
So agency staff, where we have to call upon agency staff, then we find ourselves in a position of having to pay what the standard rate is for those agency workers, and were we not paying that, we wouldn't secure the worker because somewhere else would pay that rate. What I would say is over the course of the last few years, we've almost halved our use of agency staff, and I think that's really important because it's not just about the amount of money that you pay, but actually having a regular member of staff who becomes more and more familiar with your services and more embedded into the organisation. It's often more rewarding for the individual staff member, and it makes it much easier from a healthcare organisation perspective to be able to roster and manage shifts. So I think it's a good news story, the fact that we've halved our use of agency, but we do still from time to time need to draw upon that. And
that's purely down to recruitment and retention, the fact that you need extra staff.
And often in situations where you need a specific member of staff with a specific skill set because of an unexpected illness somewhere else in the service.
And that will always be the same problem that we have being in a remote location, yeah?
It always will be, but it's a question of minimising the impact, which I think we've made good progress with.
Tim dropped a note in. On a brighter note about Manx Care, I recently had an emergency admission to A&E. Emergency care was excellent under difficult circumstances. I might say in a couple of hours I was moved to Ward 1. The team were fantastic. I was extremely well looked after, and they turned a rather nasty situation into actually a very enjoyable stay. First-class service, and everybody involved credit to where it's due, says Tim.
So it's fantastic to hear stories like that. And I think, we forget, if over the course of the year, if you include our primary care contacts and our outpatients and those people that present to A&E, we're delivering over 1 million episodes of care each year. The vast majority of those go very well. We tend to hear more about those where we could do better. And it's important that we hear about them, but it's also important that we don't lose sight of all of the episodes that go really well.
OK, we're with Manx Care today on Mannin Line through till 1. So text, email, call and WhatsApp. More messages and more questions in a moment.
For a wide range of wood-burning stoves and a complete installation service, visit The Snug in Ramsey. And we don't stop there. Kiln-dried firewood and full aftercare service, including chimney sweeps and maintenance. Call The Snug in Ramsey.
A great night's sleep got even better with Zed's Bedding Store. From quality Beldorm bed linen and mattress protectors, fleece and woven throws, to luxury duvets from the fine bedding company. Zed's Bedding Ramsey, next to Isle of Man Bank. Now is your chance to recognise inspirational individuals and groups making a real difference on the Isle of Man with the Heroes of Man Awards, brought to you by A Little Piece of Hope charity. From quiet acts of kindness to outstanding community work, nominate your hero or heroes at alittlepieceofhope.com/nominations. That's alittlepieceofhope.com/nominations. Nominations close Sunday the 30th of August, with the awards ceremony late January 2027. Details coming soon. This advert has been kindly supported by Cayman National Bank in the Isle of Man, rewarding relationships built on trust, and your nation's station, Manx Radio.
Important dates are coming up for the House of Keys general election. If you want to vote by post, apply early so your ballot pack arrives in good time. You can also hear from your electoral candidates to find out what they stand for before polling day, the 24th of September. Pre-election meetings will be held in each constituency from the 7th to the 18th of September. Visit elections.gov.im to check postal vote deadlines and download the application, and to find your local pre-election meeting details. You can also email elections@gov.im or call 685 754.
The House of Keys general election is on Thursday the 24th of September, and Manx Radio is helping you get to know the people asking for your vote. From Monday the 31st of August, join us for our live constituency debates hosted at Studio 1 by ELS Group, where every candidate standing will be invited to take part. Want to be there? Well, just visit the Manx Radio election mini site, find the date of your constituency debate and apply for your free audience ticket. Find all the details at manxradio.com.
The Mannin Line with Andy Wint.
It's 11 minutes before 1, and let's get to the phones. We've got Dewan with us now. Hi, Dewan, you're live with Dr. Chris Stockport.
Thanks, Andy. Chris, how are you?
Great, thank you, Jim.
Thank you. 2 questions for you, Chris. The people that are, you say, on agency, or people that are transiting, working over here as doctors or as foster care workers or anything really, do we pay for their trips home out of our Manx Care budget? My second question is, on leave to remain visas for people who are staying here, do their dependents come? Is there a limit on how many go onto the healthcare register, and do they get put on the healthcare register and the dental register straight away while they're here? And if we got to the stage, hypothetically, of, say, asylum seekers coming here, would that also affect our health service and they be put on that and be a drain to our budget?
Okay.
Oh, interesting questions, and I'm not entirely sure I can answer all of them, because some of that depends upon the immigration rules, and that's outside of my control, and I'm not entirely cited. What we do is put them on the healthcare register in exactly the same way as we ought to do with anybody else with leave to remain. So we follow the legislation and the rules that are in place. And in terms of agency workers, the negotiations that occur with the agency from which we are contracting that individual are robust, and we provide nothing other than what is the accepted market rate to secure a member of agency staff where we need them. As I said earlier, we really try to limit where we use agency workers. Sometimes it's simply necessary.
Ewan?
Yeah, and I think a lot of people don't realise the scope of Manx Care, because people just think of it as the hospital per se and the doctors, but obviously it's childcare, Manx Care, and foster care, and everything is included in that. So it's quite a big circle of people. But I'm just interested in just drilling down into that subject. If say for example people come over here on the remain to leave visa, and their dependents, would they be on a waiting list for dentists as local people are and have been waiting for 2 or 3 years to get on there? Or would they be queue jumped and put onto the dental list before local people? Is probably...
Sorry. He disappeared anyway. I think we got the question.
I can definitely answer that question, which is there's no queue jumping involved at all. They'll be put into the system in exactly the same way as any other new resident would be.
Okay. Well, that falls onto another one. This is from Gaz, and it's about Manx Care charging for A&E. Does Manx Care charge for A&E treatment for sporting injuries, which could be claimable under club insurance policies?
No.
Okay. At what point does Manx Care start charging as well? And this is for people who come here. What's the process for charging reciprocal arrangements? How does that work?
The reciprocal arrangements are complex. They're laid down in an agreement with the UK, and they cover the same arrangements for Isle of Man residents who find themselves unwell when visiting the UK. So it's a two-way arrangement. They can be complicated in terms of which treatments are provided for free and which parts of the treatments are chargeable. But we have a fairly slick system in terms of establishing that and making sure that we claim the appropriate fees back. As you'll appreciate, TT brings each year many people to the island who are not covered by NHS funding agreements, and so we have a fairly well-oiled machine to make sure we are claiming back everything that we can.
Okay. I was very recently involved in a situation where a friend became unwell. The ambulance crew who attended were exceptionally caring and thorough. They made a difficult situation much easier, and a grateful thanks to... They often get overlooked, don't they? Or paramedics. They're not ambulance men anymore, are they? They're paramedics.
They're paramedics, indeed they are, and highly skilled too.
Okay, a couple of messages in now. Just going back to that DNR, could you clarify when somebody thinks they haven't approved putting a DNR being on records, what the situation is and what any relatives can say about it, how they take that up?
Yeah, so if somebody is unaware of a DNR and subsequently becomes aware that that is on their record and that they disagree with it, then they should, of course, bring it up with staff at the time. And if you're an inpatient, then you can bring that up with the ward nursing staff just as much as you can bring it up with the doctor overseeing your care. And I would then expect them to have a conversation about why that is the case and why you're unhappy about that, and properly explore the situation. There are some circumstances where the law allows doctors to place a DNR status where it was inappropriate to discuss the matter with the individual concerned, and those situations are usually to cover. For example, you go into hospital and you're so unwell that you're unconscious, and a decision has to be made before an opportunity arises to be able to discuss it with you. But I would expect as good practice in all those circumstances for the family members around you to have been made aware of that situation, even if you were not able to be aware of it yourself. And I would welcome any challenge from anybody if they feel that status is not appropriate.
Okay. Dr. Chris Stockport's been with us for the past hour, the interim Chief Exec of Manx Care. Thanks for being with us, and hopefully see you again soon. I must point out, by the way, forgive this, Dr. Chris Stockport, while we've been on the air, has become a grandfather. Congratulations.
Thank you very much.
That's it. You want to follow up on anything? We got an open line tomorrow. You've been with Manx Care for the past hour. And again, thanks to Howie on the phones. And enjoy the rest of your Thursday.
WINT